Welcome back. Open enrollment is underway or fast approaching for a lot of insurance providers. And as you weigh your options, keep in mind there might be savings that you may not even realize that you could be getting, maybe even cutting off of your grocery bill. That is a big one. And joining us is Ann Kinsella. Did I get that right?
Yes,
Ann?
you did.
Thank you. Okay. VP and General Manager of Medicare at Medica. Thank you for joining us. We want to talk about this one with fruits and veggies. First of all, this is specific, to certain providers or certain program that you have. But tell us about this and how people can save on their grocery bill.
Sure. This is one of our Medicare benefits. So for our Medicare members, they can save if they have a qualifying condition, which most do. 83% of our members actually qualify for this benefit, and they can save 50% on any fruit and any vegetable consistently at any number of grocery stores. They just need to bring in their app or their card, and they can, right as they're going through the checkout, they will get 50% taken off of some of the things you're seeing here today.
Wow, 83% qualify, but a lot of people don't take advantage. Do you think they're just not aware of it, haven't gone through the fine print? What do you think the reasoning is? Because as we know, I mean, inflation, prices of everything are going up.
Yes, inflation's definitely top of mind, and winter's coming, and everyone's telling you that medicine is food, right? So food is medicine, so you want to take advantage of that. I think a lot of people may not know. We automatically, if we see that you qualify, we'll send out a card or instructions on how to use the app. But I just think people aren't really thinking about a health plan offering benefits on something like food. But more and more are looking at options to keep people healthy in different ways other than just going to the doctor.
Right. We've heard of the gym memberships. If you go X number of times a month, you can get a discount or things like that. Do more programs than we maybe realize provide discounts on grocery bills, or is this unique?
We think our benefit's unique to Medica, but there are other health plans that are looking at different kinds of ways to support nutrition. What we think is unique about this one is it's consistent. Every single vegetable, fruit, every time you go to the store, up to a certain amount per quarter, you can save 50%. So we do think ours is a bit unique, but other plans are looking at ways to support nutrition as well.
And I'm one of those people watching the show probably know I'm a little bit of a procrastinator when it comes to things. We were talking about our Halloween costumes and, last minute things when open enrollment comes around. And you're in open enrollment right now, you mentioned. It kind of can creep up on people, and they need to do their homework and have some time to dive into these details. If you have broad recommendations for people as open enrollments are happening or getting close, what recommendations would you have of what you do to find the right plan for you?
Sure, and like you said, open enrollment for Medicare is on right now through December 7th, so people are getting bombarded with ads and mailings to their homes. So really think about the key things for you. We find the most highly shopped benefits, see if your doctor is in network. Also, check your prescription drug coverage. And I would say network, prescription drug, think about what your healthcare needs are going to be. A lot of people use help from a broker. But those are the key ones. And co-pays, co-insurance, kind of laying those things out. It can be complicated, but if you think of those key things you use throughout the year, look at that, and then also see what other supplemental benefits that plan might offer that would be helpful for you, which is another reason I think everyone goes to the grocery store. Everyone should be eating fruits and vegetables, myself included. So see if there might be something like that available on your plan, and check out Medica if you can.
Good reminder, especially as we're trying to balance out some of that candy this weekend.
Right.